Good morning, LinkedIn. Apologies for the scruffy look. Didn't have the energy for a shower, didn't have the energy to put my makeup on, and I didn't have energy to iron my t-shirt. Such is life. But I am an ME advocate, and if that makes you realise how limited my energy is, great. This is a message really about long COVID and these restrictions that are lifting. If you are a COVID denier, please don't reply to this saying we need to get on with our life. You need to realise previously fit and healthy people who were doing triathlons, going to the gym 6 times a week, only had a very mild case of COVID, are now very poorly. They're having CT scans, heart scans, MRI scans on their lungs. Their kidneys aren't working. They've got liver failure. Some are now being diagnosed with ME/CFS, rightly or wrongly. We won't know whether COVID actually leads to ME/CFS until much more research is done. But at the moment, because they are meeting the diagnostic criteria and they have post-exertional malaise, they are being given an ME/CFS diagnosis. So if you're thinking I'm invincible, I would ask you to think again, because trust me, when you get chronically sick with a disease that medics don't understand, because in COVID's case it's because it's a new disease, with ME/CFS it's because it's a very neglected disease and only around 10% of medics worldwide have ever received any training on it, and most of that training is a psychosomatic illness. It's false illness beliefs. Just tell them to go and exercise, they'll get better, when actually, if any of you want to do Stripy Lightbulb training, you will see actually it's a real biological disease that's been recognised as neurological since 1969 by the World Health Organization. And it's almost as if, on a very basic level, there is something that lays dormant in a percentage of human bodies, and all it takes is a trigger to have this neurological disease, which is why a lot of ME/CFS cases are triggered by viruses, but it's also triggered by surgery, emotional trauma, anything that makes, the old stereotypical human running away from a saber-toothed tiger, something that makes you go fight or flight. That kind of reaction. We don't know what causes it, but it is a trigger. Anybody could have this trigger. You simply do not know if you're going to go on to get chronically sick. So please take COVID seriously, because there are already, according to the Office of National Statistics, 986,000 long COVID patients. However, there is another study that says up to 2 million. Now, given that maybe, I think it's 55% are going on to recover, but at the end of the pandemic, we may well have 1 million plus people that have been sick for longer than a year. Many of those will have, if they've got ME/CFS, lifelong disease, lifelong chronic illness. And as much as you want your freedoms now, trust me, if you get chronically sick, you will not be able to work. You won't be able to have a social life. You'll find travel incredibly difficult. There is a reason why Foggy is a global globetrotter, adventurer, because that's something that ME patients find exceptionally difficult. Travel is something that ME patients can't do easily. So while I just want to get back to work, and while employers are saying, I want my business up and running now, if you've got your staff are 40 and under, they are, I think it's something like between 10 and 20% are getting long COVID. If they're not in the workplace for 6 months, you're screwed. So you need to make sure that your environment is COVID safe, because ME/CFS has been badly, underlined 3 times, neglected by governments worldwide for decades. In the UK, it's particularly bad. They've literally told psychiatrists to push the narrative that it's a psychosomatic disease, and because it's psychosomatic, they don't have to bother finding treatments or a cure. And I genuinely think that that's what they were thinking long COVID was going to be, that they could do exactly the same with long COVID, but there are simply too many people now need to take long COVID seriously. And I will say, during my, 14 years as an ME patient, I have never had a CT scan, MRI scan. I've had 1 echo, but that's because I was getting chest pains. I've never had my organs looked at. with my ME, but I do have very similar symptoms to a lot of long COVID patients who are getting MRI scans, CT scans, echoes, you name it, they're having it, which is great because I'm also a long COVID patient. It isn't about that. But we, as ME patients, we may well have organ damage, but it has never been taken seriously, and we just don't know if any of us have got lingering organ damage from whatever triggered our ME/CFS. It's neglected. And they are trying to do exactly the same with long COVID. And as a long COVID patient also, I'm kind of feeling like, do they want to just put me in the ground? Because where is the care and support? Where is the narrative? You could get chronically sick. It's almost like we're collateral damage, but that's up to 20% of anyone that gets COVID-19, even asymptomatic and very mild cases. I've been reading Twitter this morning, and some people are getting sick 3 months after their acute COVID infection. Really need to take it seriously, and you could have an entire generation of school children with a chronic illness if you are not careful. I think there's already 60,000 children affected by long COVID in the UK. All of those children need to be supported in the same way that ME/CFS affected children need to be, because most of them have got energy issues. They simply do not have energy to function. So please do take long COVID seriously, because if everybody keeps thinking, oh, it's fine, they'll all get better eventually, and then we get 2 years down the line and we've got 1 million people with a chronic illness, 1 million people who aren't working, 1 million people who are unable to contribute to the economy, how's that going to help the economic growth? You need to think long term. You need to take this chronic illness seriously now. I'm not talking treatments and cures, I'm talking about prevention. Make sure your member of staff or your pupil takes care of themselves, rests, doesn't rush back to work, because it's the people that got sick in the first wave rushed back to work because they wanted to help with the COVID effort. I'm talking specifically about medical professionals now, and most of them ended up relapsing and they haven't got better. So you need to make sure you rest, not indefinitely, but just to give yourself the best chance to recover. So please don't think the government's going to support these people, because they won't. I know that as an ME advocate. I know that as the director of Stripy Lightbulb CIC. Why do you think a patient who's got barely any energy has had to set up an education platform? There's desperate need for social change with ME/CFS, and now long COVID is going to have exactly the same problem. Please do take it seriously. If you've got any questions, please do email me. Thank you very much. Catch you later.